Asthma is one of the commonest respiratory diseases in India. Hi, this is Dr. M. Harish, Consultant Intervention Pulmonologist from Chennai. Asthma, along with COPD, constitutes almost 60 to 70% of total obstructive airway diseases in India. We have almost 13 million asthmatics in India, and it contributes to one of the major causes of disability adjusted life year, that is the amount of days wasted in a year. Asthma is diagnosed through spirometry. Spirometry is one of the commonest modality of pulmonary function test, where we measure the lung capacity and see for reversibility. Once asthma is diagnosed, we give the patient regular inhalation therapy either through a DPI or an inhaler or through a nebulizer if the need be. Once the patient takes these inhalation therapy, the patient has to be on follow-up regularly, at least for the first 3 months, and then we give an action plan to the patient on how to titrate the therapy for asthma. The commonest triggers of asthma is usually allergens, some environmental toxins, pollutants, and also food, and also pets, danders as well. If the asthma is uncontrolled, in spite of maximal optimized therapy, we do something called skin prick test to find the cause of allergen, and also we try to narrow down the phenotype of asthma, meaning in simpler words, what causes this airway inflammation. In other words, what causes the airway narrowing. When the airways are narrowed, we have certain mediators which helps to narrow down the cause of airway narrowing. Once that is found out, we give targeted therapy for those airway narrowing. In that case, it is considered to be a severe asthma. Once the patient is uncontrolled with maximal therapy, we do all these things and directly hit the inflammatory mediator. When you have any of the respiratory symptoms like cough, breathlessness, wheezing, chest tightness, chronic nasal allergies, please consult your respiratory physician and try to narrow down the cause and get the right treatment. Thank you very much.